What's up? Welcome to my YouTube channel. In this video we are talking about temporomandibular joint. Yes, as the name suggests, the temporomandibular joint is formed between which bones? Yes, you see this is the mandible bone, so it is formed between mandible and temporo means temporal part. Yes, the temporal bone. So the temporomandibular joint, under this heading we will cover the introduction, the type of joint, then the articular surfaces. Okay, after this we will come to the ligaments, the blood supply, the nerve supply, and finally the most important part, which is the movements and the muscles producing the movement of temporomandibular joint. So without further ado, let us start. Now, what is the type of joint? Now you see that temporomandibular joint is basically a synovial joint of condylar variety. Why it is called synovial? Because synovial membrane and synovial fluid is present. And why it is called condylar? You know that in case of condylar joint we are having one condyle, yes, like this, and it is actually housed in an ellipsoidal groove like this. For example, you may take into account radiocarpal joint. The better diagram you can see here. This is a condylar joint. The movement is limited. Yes, these are the type of movement you can perform in case of a condylar joint. It is less movable than ball and socket joint, and here you can see that the blue colored membrane, this is nothing but the synovial membrane containing synovial fluid. Now, what are the articular surfaces? The articular surfaces, this is from the temporal part and this is from the mandibular part. Okay. Now the temporal bone we are having articular tubercle. Then we are having the anterior part of mandibular fossa, and then we are having tympanic plate. Let us have a look at this diagram. You see that this is basically the tympanic plate. Yes, this is the tympanic plate. After this we are having what? The articular tubercle. This is basically the articular tubercle followed by the mandibular fossa of temporal bone. And which component or which part from the mandible is contributing towards forming this joint? Yes, this is the head of the mandible. This is the head of the mandible, which is mainly forming this temporomandibular joint. So we are having this articular tubercle right here, we are having mandibular fossa, we are having the tympanic plate, and this is mainly forming the ellipsoidal groove, and into which the condyle, that is the head of the mandible, is housed to form the temporomandibular joint, which is a condylar joint. Okay. Now we come to the ligaments of temporomandibular joint. What do we mean by articular disc? Articular disc is basically a fibrous plate. Yes, it is basically a fibrous plate which divides the joint cavity into an upper and lower compartment. This is the fibrous capsule, and this fibrous capsule you can see that it has one concavo-convex. This part is convex and this part is concave. So concavo-convex superior surface and one concave inferior surface. Okay. And this articular disc which divides this joint cavity into upper and lower compartment. So the upper compartment, that is this one, it permits gliding movement. On the other hand, the lower compartment, it permits gliding and basically and most importantly rotatory movement. So upper compartment basically gliding and lower compartment rotatory movement. Okay, and what are another function of this articular disc? So it basically helps in shock absorption. Yes, it basically helps in shock absorption. come to the movements of temporomandibular joint. Okay, now you see that what is the main function of the temporomandibular joint. Now what is the main function of the movement of mandible? Basically the temporal bone, it remains fixed, but the mandible bone, it will move. Yes, and this movement will mainly facilitate the mastication process. Yes, the chewing process. So what are the muscles that are responsible for the movement of temporomandibular joint? They are also responsible for mastication. Hence these are called muscles of mastication. And what are the four muscles of mastication? They are basically pterygoid. They are pterygoid. Under pterygoid we discussed two pterygoid, medial and lateral pterygoid. Then we have masseter, and we are having temporalis. These are the four muscles of mastication. Let us see what is the function of each. Now the mandible, it will perform, the temporomandibular joint perform two specific types of movement. First, elevation and depression. The second one is protrusion and retraction. Here this is the protrusion and retraction, and second one is elevation and depression. Now the muscles that will cause elevation, it is mainly temporalis, masseter and medial pterygoid. Yes, the muscles which are responsible for depression, they include mainly the digastric muscle, the geniohyoid and the myohyoid muscle. The answer is simple. Why it is so? Because the geniohyoid, it is attached to the genioid tubercle of mandible to the hyoid bone, which is present inferiorly. Similarly, myohyoid muscle, it is also attached to hyoid bone and the mandible. Yes, myohyoid muscle. Similarly, in case of elevation, you see that the temporalis muscle, here the temporalis muscle and the deep part of the masseter muscle. So these muscles, they are actually present superiorly, and hence they will cause elevation. They will cause elevation of temporomandibular joint. Similarly, we are having the muscles which will cause retraction and protrusion. So the two pterygoid muscle, that is the lateral and medial pterygoid, they will cause protrusion, or they protrude the mandible out. On the other hand, the horizontal fiber of temporalis, the posterior horizontal fiber of temporalis, they will cause retraction of temporomandibular joint. Now we come to the blood supply and nerve supply of temporomandibular joint. You see that the blood supply, basically the arterial supply with the help of superficial temporal and maxillary artery, and the nerve supply, it is with the help of mesenteric and auriculotemporal nerve. What will be the nerve supply of the muscles of mastication? It is a very important question for viva and also for the theory purpose, that the muscle of mastication, yes, what are they? The masseter, temporalis, lateral pterygoid and medial pterygoid, all of them, they are supplied by the mandibular branch of trigeminal nerve, that is the cranial nerve 5. But one thing to be taken into account, that except the medial pterygoid, all the other muscles of mastication, they are supplied by the branches of the mandibular nerve which are from the anterior division. Yes, so this lateral pterygoid, masseter and temporalis, they are supplied by the anterior division of muscle of mastication. On the other hand, we are left with medial pterygoid. Yes, medial pterygoid, it is supplied by nerve to medial pterygoid, which is a branch of trunk from mandibular nerve. Okay, so in this way we have completed the movements of temporomandibular joint along with the muscle of mastication. To the relations in brief. Okay, so the relations, actually I have given a diagram right here. So the relations are not so important for temporomandibular joint. They are given in the textbooks. so you can refer it directly to it. I'm not going to narrate them. Okay, so in this way we have completed the temporomandibular joint. A brief overview. We have first started from the introduction part, then the type of joint. Yes, it is a synovial joint of condylar variety. Then we come to the articular surfaces, the ligaments, yes, the fibrous capsule and the articular discs. The blood supply, nerve supply, a brief. Yes, blood supply, maxillary artery and the superficial temporal artery, and nerve supply, auriculotemporal nerve. And the movements, I see it is a very important part of temporomandibular joint, the movements and the muscles of mastication. Okay, the muscles of mastication. So in this way we have completed today's session. So if you like my work, then please do like, share and subscribe to my channel. Thank you very much.